Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. We're going to learn about clinical management, practice management, and the emotional management of dentistry. Let's learn how to be happier in dentistry. Let's go. Thank you to our sponsors, Altum Dental Lab Group and RDT Dental Lab in Toronto. Hello, everyone. Thank you so much for joining another podcast. So grateful to all of you for listening. This is a very special episode because we have my friend Mo, who's going to talk about overcoming fears in doing those challenging cases. So the way I met Mo was through Instagram, and I thought, oh, this is a cool guy. And then we met for dinner because we both know my former dental assistant, and three of us met. And I didn't check out Mo's profile until after we had dinner. And I went, oh my gosh, like Mo is one of the elite in the world where he's doing like zygomatic all on X implants. And I was like, we got to talk about like how to overcome our fears to do big cases like this. So at the end of this episode, I hope everyone listening, can overcome some of their fears and start being selective with their cases and start challenging themselves. So, Mo, welcome to the podcast.
Hello, hello. I'm very excited to finally be sitting in this chair. I'm in the hot seat.
We're excited to have you on. So, Mo, tell us about yourself.
Yeah, so my name is Moemen Metwally. I grew up in Windsor, Ontario. My education was really all over the place. I started off at University of Windsor, then went to Wayne State for a little bit. Fun fact, I never finished undergrad. I got into dental school before I could finish, and I took off. I went to San Francisco for dental school. I went to University of Pacific in San Francisco for dental school. I had a hell of an education. I had a hell of a time. I thought I got, world-class education, honestly, for the most part. And I spent a year at a very surgery intensive program in Canton, Ohio, in a GPR. It was a great experience that unknowingly went on to change my career path. I've always liked implant dentistry. It's always been kind of like my focus from dental school, honestly. Like I went through dental school being obsessed with implant dentistry. And got out, worked all over, worked in Texas for a bit, and then I've been back in Toronto now for probably going on 7 years now. I have a unique practice my practice is very unique. So I have a small practice limited to implant dentistry, where I know you guys had Alex on here, like a very tiny, like something's like that, except much smaller, where we just focus on implant dentistry. That's all we do. So, we don't do root canals or braces or aligners or any of that stuff. Our primary focus is implant dentistry and full mouth rehab. So if, the case requires some crowns and veneers, we're doing that, but 99.9% of everything we do is just implant dentistry. And I like to say, we do everything from single lower premolar, your very straightforward case, to full, a zygo redo case, right? Or redoing a failed zygo case or something. So, and anything in between. So anything that's related to implant dentistry. That's kind of me in a nutshell. I live here in Toronto. I got 3 kids, and if I'm not at work, I'm chasing one of the kids around. Keeps me
I'm glad
very
we were
busy.
able to catch you for this
Yeah.
episode. So, Mo, how did you go from like even that scary step of doing your first implant to doing all on X to doing all on X zygomatic cases? Tell us about
So,
that process.
yeah, that's a great question. I often get asked that question, and I'm pretty easy to get a hold of. So on Instagram, every once, like I'd say probably at least once a week, someone will message me something along those lines. And I think I like to use the analogy of building a pyramid, not because I'm originally Egyptian, okay? But but I think the building a pyramid analogy is a great analogy, and I think of it as, you gotta lay your foundation, and then you're just stacking different things and different concepts on top of it. So, when you think of as dentists, we're kind of like our training pathway is very different than our colleagues in medicine, where we have access to a shortcut where we go straight from dental school, private practice, and you're just like at it and you're doctor, blah, blah, blah from day one. Our colleagues in medicine don't have that at all. You know, you go from medical school to 5 years or 4 years of Mr. Nobody, right? And that's when you're really like your career is being shaped during that residency period. And a big part of residency is laying down your foundation. So when you graduate after, say, let's say a 4 year OMFS residency program, you don't come out after 4 years and all day one you're an expert at everything OMFS, right? But you have a really, really strong foundation. That means that, you know, within the implant dental world, right? You know, you're really good with local anesthesia, you're really good with case selection, you're really good with pain management, you're good with you know, bleeding control. So there's a lot of things that are associated with implant dentistry outside drilling a hole and putting a titanium screw in it. And all these concepts just start to come together. And I think the most exciting thing about implant dentistry is that it captures many things from different aspects of dentistry and just puts them all together under the umbrella of implant dentistry. So it makes it very challenging and makes it very fun. And I think one of the highlights of my like day is that there isn't a day in my life that I go in and I just feel like a master and I know it all. It's a constant humbling experience. It's a constant learning experience. You're just learning different things nonstop and, you know, kind of going on 15 years now. But I'm definitely a new dentist, right? Like, you know, I think I mentioned this to you the first time we met. What is the definition of a new dentist to join this club? Because I I feel like I'm always a new dentist, right? Like I don't know at what point I'm gonna be like, I got this, I know it all. I think it's just like this long journey where it's, you know, you just stack different things on top of each other. So you start off with just your very, very basic foundation, and then you stack another layer on top and another layer on top, and then you don't realize how much you've learned, how much you know until you sit down and explain to someone else something. You've I think it just hits you at some point and you go, wow, I can't believe like I'm at this point where I know this much. But it is really, you don't just jump into one thing all of a sudden. It's just layers of learning on top of each other.
Oh, I like that. I like how the analogy of the pyramid, because I've heard from young dentists, and I feel like it myself when they're comparing themselves to their peers and they're saying things like, "Oh, my classmate, you know, we graduated 5 years ago, and my classmate's doing implants, and I'm not doing them." And that comparison, but then you have to think about, okay, but you have a lot of the foundations. You've had 5 years of reviewing medical histories, doing sutures, flaps, local anesthesia, patient management. Like you have a lot of the foundations. So when you are ready to do implants, you're going to be pretty confident.
100%. Yeah. And you like, you know, you set patient expectations. And I think that is something that takes time being in private practice. Like you just, another thing is just kind of learning who you are as a dentist, right? Like being comfortable with your dental personality. Like we're all a little bit different sitting in a chair next to a patient than we are outside the chair. I tend to be very much myself, so I'm kind of goofy and down to earth and whatnot, and I'm kind of very much like that. And I think to a lot, I might come across unprofessional, but it's very relatable to a lot of patients. And I think getting to that point in your career where you're comfortable with how to speak and stuff has nothing to do with putting an implant in. A question I get sometimes is, how do you handle telling a patient that an implant failed? And it's like, I don't know. Just say, hey, it didn't integrate and we're gonna have to redo this. And we don't make a big deal out of it. It really isn't like, you know, we place a lot of implants in my office and failures happen, right? So I think you nailed it there. Like there's things that you know that you're not giving your credit for, especially when you've been at this for, you know, maybe 2, 3, 4, 5 years. I think the first year or two are always really rough. Um, even knowing what you like and what you don't like, you don't know that. Yeah. And every once in a while, I'll talk to someone who just got out of dental school and they'll say, I'm really good at root canals and I really don't like pediatric dentistry. And I go, "Ugh, dude, you've been at this for like 3 weeks. Like, don't put your blinders up. Like, just keep a open mind. You don't know what you like. You don't know what you don't like. And some of the things that you thought you don't like, you may go on. That might be your specialty after a while. That might be your thing. Because you're exposed to so little in dental school. Like, you're just seeing the tip of everything in dentistry. And you can cover, we used to joke about this, my buddies and I, that all of your dental school requirements, sometimes you'll cover that in a busy clinical day. You know, you may have done like 2 endos and 3 crowns and like 15 extractions, and like, in a week you've done all of your dental school requirements, right? Like, so what you thought you hate and what you thought you're really good at is based on such little experience. So just keep an open mind. Like, that's the best thing you can do for your career. It, when you're just getting started, just kind of go at it, keep an open mind, talk to different people, and you'll be amazed what you end up liking and what you end up don't liking.
Yeah, and Mo, like, how did he even, have the courage to place that first implant? Because we went out to dinner with my former dental assistant, Alex. She used to work for a dental implant company, and she said that, when they reviewed, all their data, they realized that after dentists take their courses, if a dentist doesn't place an implant within the first 6 months, they never will.
Yeah,
So,
it's the same with a few things actually. Even with IV sedation, they always say the same thing. Like, if you go through your IV sedation training and you're not like out doing it, you're most likely not going to be doing it. So I think I kind of had a little bit of an advantage because so when I went to dental school, dental implants obviously were a thing. Like, I'm not that ancient, but it was not normal to place dental implants in dental school, right? Like, that was not a commonplace thing. Um, I had this unhealthy obsession with dental implants, honestly, since I was in dental school, and I placed I placed my first implant in dental school. I did a couple cases of mini implants for overdentures. I just was obsessed with the idea of drilling holes and sticking implants in people. And this is well before Instagram, before it was cool. Everything about it fascinated me. And this was my calling. I just had to put more implants in. And then I did a residency. So we placed some implants in my residency. And right after my residency, and when I did one of those comprehensive maxi courses, and it was just very, very intense, a little bit of everything. And just, I had a goal of my first 5 years in private practice to consider myself like a resident. And I was like, my first 5 years in private practice aren't about making money. It's about trying to learn as much as possible. And I
oh, I
thought
love it.
of, like one of my best friends is a pilot, and a couple of my other really good friends were physicians, and none of them were really making money. So I was like, as long as I can pay off my student loans and I can afford to live, my primary goal is going to be take as much to ease as possible. And the majority of my continuing education early on, like I would say 90% of it, was implant dentistry or IV sedation. They were definitely my primary focus early on, was that. And so I think my advantage was I never placed my first implant like by myself in a private practice setting. But I do a lot of not a lot, but I do some hands-on education courses for dentists that are new to implant dentistry. And some of these have been practicing for a long time. And it's just like what you said, a lot of times it's just grabbing that handpiece and putting in that implant for your first go. I find it helps if you've done it a few times with somebody else, because at some point someone will ask you, is this your first implant? And if you're nervous about answering that question, then you can comfortably say no, and you're not lying because you have placed your first implant in an educational facility or at a course somewhere, or whether it's a residency or you're at a course somewhere, or with someone, like we do some in-office mentorship stuff, or with someone in a situation like that. um, but at some point, you just gotta, take the plunge, right? Now, I don't mean close your eyes and just do harm, right? You're gonna have the education, you're gonna have the training, but at some point, you gotta go from training to doing, right? Like, you gotta cross that barrier, and everyone is a little bit different, right? So my wife, who's also a dentist, says that she's not comfortable doing anything until she feels like she's very good at it. She's like, I'm not going to do this in private practice unless I feel like I've been educated really well on it. And other people may feel comfortable. Like I generally will take on a new procedure if everything around it I've done before and there's one small thing that I'm adding to it. So if I'm doing something for the first time, this might be my first, lower mandible ridge split, right? Like for example, right? This is not my first full arch. This is not my first full thickness flap. This is not my first, localizing a mental nerve. This is not my first time putting a screw in. This is not my, so there's so many parts of the procedure that I'm doing. It's not my first time. But this one little thing that I'm doing, part of this procedure, might be my first time. Say, for example, I've done upper ridge splits, but I've never done a lower ridge split. So it makes it a lot easier. And that's where I get back to the pyramid analogy, where everything, the foundation is there, and the next layer of foundation is there, and the next layer of foundation is there. And I'm adding one new trick. I'm adding one new thing that I'm doing. But everything else I've done. And I think that's the advantage of coming out of a lot of residency program. Again, if I go back to like a OMFS residency, you have really strong foundations, right? So even though you might be putting an implant in a site that you haven't put an implant there before, a lot of everything there is involved. So getting enough education that makes you everything you're doing, you're not doing for the first time. Because that's a bad place to be. If everything part of this procedure is the first time and the first go at it, you're more likely to make mistakes. But you just got to take the plunge at some point.
Yeah, I like the fact that you're just adding a little bit because that's just like even in sports, like you're
Yes,
just adding a new element.
that's right. And it's not as intimidating at that
Like you're
point.
not running a marathon. Like, can you imagine you've never run before and now you're doing a marathon? You're
That's
doing the
exactly
5K,
it.
then you're doing the 10K, then you're
That's
doing the
right.
half.
That's right. That's right. See, I'm not a runner, right? So, but that's also a great analogy. I learned from I worked with someone who used to run marathons that apparently when you're training to run a marathon, you never train up to a marathon. The first time you're
Yeah,
doing the
it's
full
true.
27 is the day of the marathon. And I didn't know that, right? I was like, oh, I thought you'd like run a bunch of these in your practice before. And she's like, no. She's like, you train up to it, and then the day of your marathon. But I'm like, yeah, that makes great sense. Like you may have never
Yeah.
run the full 20, it's 27.5, right? A marathon? 26.
26.2, something like that.
Something
And
like that. So I'm
a
like,
half.
clearly not a runner. But I was like, oh, that makes sense. And that's also a great analogy, right? Like, who cares if I haven't run 26 miles? I've done everything else.
Yes.
Yeah.
Okay. So what if you work at a practice that doesn't do implants? So you took the implant course, and then how do you, as an associate, how do you start that process in your office where, you got to tell the front desk, accept payment plans, you got to train your assistant, you got to have your treatment coordinator on the ball so that, she's ready to talk to the patient about this big case. Like, how do you do all of that?
Yeah, you know what? That's a great, great question. So I was once an associate, right? Like I'm not born into dentistry. My dad's not a dentist, nothing like that. So I was once an associate, and I know the struggle of being an associate, trying to introduce a new procedure that an office doesn't do. I think it's the number one thing is that you as a provider have to be confident in what it is that you're trying to provide. Everybody else around you, the rest of your team, has to understand that this is something that you know what you're doing, right? And they have to have your back in the procedure that you're doing. It also involves quite a bit of education within, like you educating the rest of your team. So in my practice, we do implants, 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 right? But we still do these little education things where once a month we sit down and we do like an in-house, like where we're picking a topic and we're talking about it, right? And you're going to talk to your front desk about the codes and the procedures and how it works. So I would do this. Even I did mobile surgery for a little bit. I worked in multiple offices. I would sit down the staff and we do this like implant dentistry 101 in like crash course in 45 minutes, right? This is a screw. Here's what an implant is. Here's how we place it. Here's the phasing for it. Here's the advantages. Just like the basics of implant dentistry in 45 minutes. Just dumb it down and educate the rest of your team. But everybody else on your team has to participate in it. So your hygienist is going to help you in treatment planning and presenting and case selection. Your assistant is going to help answer these questions for the patients. When you walk out of the room and you finish a procedure, they're more likely to ask your assistants questions than they are to ask you. How do I take care of this? Can I eat today? A lot of these questions will go to the assistant. I will cover them. It's in the written down consents. I've covered them before and I've covered them after. And I walk out the room and I hear them asking, my assistant the same question again. So I just understand that I don't do anything by myself. Like everything I do, there's a team approach to it, and the rest of the team has to be on board for you to be able to add this procedure. And it takes a little bit of time. So that means maybe early on before actually putting in implants, we're going to do socket preservation, right? We're going to prepare these sites for implants. I'm going to work with my hygienist about, why an implant is better than a 3-unit bridge, because I truly, like, I don't place implants because you make more money. Place implants because they are better than bridges. Like, I truly believe that, right? Like, if I'm going to, go around cutting 3-unit bridges all day or put implants, I think the majority of the time an implant is a better option than a 3-unit bridge. So understand these concepts, and then just spend the time talking to your team about it. Now, at some point, you're gonna have to make the case for your owner dentist that, hey, I think we should do these cases here, and I think I'm a good candidate to do some of these simpler cases. I I know, not I think, I know that a lot of owners are very hesitant of having associates place implants because a lot of these procedures are, they take a long time to come to fruition and completions. And if you're an associate that's been around for a few months and you don't have the strongest track record, and in a couple 2 to 3 months you might be gone, who's covering this case? And it's going to be a hard case to sell. But if you've been at the same place for 2 or 3 years and you're going to be there for the next 2 or 3 years, there's no owner dentist on earth that's going to say, no, I don't want you to be more productive. No, I want you. No, nobody's going to say that, right? The number one thing they're more concerned of is, do you know what you're doing? Are you going to cause harm? Am I going to have a headache to clean up? Are you going to leave and I'm going to be stuck with something that I don't do? Which I think are all fair questions, right? And it is I have a colleague of mine who, very competent dentist, very talented dentist, who, without name dropping. And he says he never lets his associates place implants. Only he's allowed to place implants. And he goes, just because I don't want to be stuck with a case where they just took off, right? And unfortunately, that's one of the downsides of implant dentistry is a lot of the treatments are long. So if you're an associate, I would say it's going to have to, there's some commitment from you to commit to these cases where you or somebody else in the office restores, like say the owner restores but he doesn't place, right? So you have that, that arrangement from the get-go. Hey, I've taken these courses, I feel comfortable place some of the easier cases, I would love your support on this, and I think together this is better for the patients. Whenever I do any education, I always say to the general dentist in the room, I go, hey, these patients, for the most part, don't want to leave your office. Like, that's bad news for me because I do work out referrals. But for the most part, the patients don't want to leave your office. And almost every single time a patient's coming in as a referral, they'll say, I don't know why they sent me here. I've told them I want him to do it. He says he doesn't do it. I don't know why. I wish they would just do it. They don't know me. I don't have the rapport. I have, 10, 15 minutes to win them over and, convince them that, hey, you're in good hands and that kind of thing. But for the most part, they've known their general dentist for a long time and they like their general dentist and they're open to their general dentist making mistakes, right? Because they just like them, right? So I would say it takes a little bit of time and just be patient, but work at it. And you can like kind of work your way up to it. Start off with, getting comfortable with extraction, start off with getting comfortable with socket preservation, and then really picking your cases. So again, going back to education, I'm doing a course and the doctor told me my surgery skills are very limited, but I really want to learn how to place implants. And I was like, that isn't like, I don't think you have to be proficient in taking out impacted wisdom teeth to be able to place implants at all. I think plenty of impacted wisdom teeth are much more difficult than placing implants. So I think case selection is more important. If you're placing single units in healed sites, that is not a difficult procedure. If you know how to do local anesthesia and you know how to do a difficult class 2 composite filling, you can place a simple implant. Like, I guarantee you, right? So it just takes, a little bit of a different mindset to be able to drill a hole and place titanium posts in there, but it's not difficult.
I want to touch upon something you just said, which is mindset,
Yeah.
because you must have a different mindset than most dentists. Be- Because, you know, going back to the analogy of running, and you asked me like, so what's the distance for full marathons? Like, I'm a runner. I run every day, but I only run 10K.
You run 10K every day?
I run, no, but when I do races, I only do 10K, but I run every day, like about like
Wow,
3 or 5K every single day.
that's
And I'm
amazing.
fine with that. I
Yeah,
never like signed up for a marathon or half
yeah,
marathon. I have no idea how to prepare. I don't know the distance because it's like, yeah, I'm happy just doing that. Like, I don't want
yes,
to challenge myself anymore. So,
yes.
so many dentists place single implants. Most dentists don't even do all All-Nex. Like, what was it in your mind that's like, no, I want to go further?
So I have I have I have so much admiration and respect for good general dentists. And I find it almost comical how often I hear someone go, I just do simple stuff. I don't do any, I just do simple stuff. And I go, you do like clear aligners and endos and restorative and crowns and veneers and some implants and your understanding of comprehensive care and managing a practice and a hygiene program. What about that is simple, right? Like you're not simple. Like, stop acting like a simpleton, right? Like, if anything, I think I've cheated because I've narrowed my practice down. And I always say, like, I wasn't smart enough to do the rest of it. So I picked one thing to get good at. Uh, but I don't think there's I don't think it's something to be shortchanged to say I'm a general dentist. I think being a good general dentist is actually very difficult. Being able to do a little bit of everything is very difficult. And I think the mindset, like going back to what you're doing, a lot of dentists are just doing single implants. There's absolutely nothing wrong with that, like whatsoever. I don't think it should limit your education that I only do singles. I don't want to attend anything else beyond that. I don't think that's how it should be at all. There's plenty of things where I might go attend a course on, and I have, I was at a laser course, and 90% of the thing was talking about laser frenectomies or whatever. Um, and it was a nice social outing. Just a bunch of periodontists around, and we talked about some surgery and implants and stuff. But overall, I was like, this is great. I got some education out of this. 99% of what they talked about today, I will never do in my life. It doesn't mean I'm never going to do this again. Yeah, whatever. So I think having the mindset of like, it's okay to continue to learn, because if you have an open mind, you'd be amazed where you're going to end up. Now, with me personally, and still ongoing, I have I don't see a glass ceiling of this is all I ever want to do. I don't ever want to pass this. I'm like, to me, it's anything and everything within implant dentistry. I want to get really good at it. So if there's another procedure out there that I don't do, I want to learn how to do it. I want to get better at it. And there are procedures within implant dentistry that I don't do as often, right? I recently, this is a true story, just happened a couple of weeks ago. I do surgery for a couple of prosthodontists, and I love him. He's got so much confidence in me, right? So he sent me a case and he was like, "Hey, we need to graft this." So I love grafting, and unfortunately, I don't do as much grafting as I used to. And it was just this really difficult anterior defect and a patient previous history of cleft palate that wasn't repaired very well, so the palate is still slightly open. And he was like, "Hey, we got to repair this, and then we're gonna do two implants, and then I'm gonna veneer this tooth." And it's like a younger girl that's like 23. And I was like, honestly, no way. I'm like, no way. I don't even know where to put my fixation screws here, right? So even though I feel I'm pretty competent at what I do, and majority of what I do, like at no point am I sitting down and looking at my patient and going, I have no idea what I'm doing. Like for the most part, every single day, I know what I'm doing, right? Um, I still was able to say, I don't feel, it's not that I don't feel comfortable. I feel somebody else out there is better at this in this particular case, like this one case here. There are too many aspects of it that make this really difficult. And I think knowing that is a good thing. So if you're a dentist and you're like, I'm going to do, singles and doubles or short span bridges, but then every once in a while you come across and you're like, I don't want to do this. I think that's very smart because you understand what it is that you can do and what it is that you can't do. But don't put barriers, like don't put hard barriers. I think having an open mind is great in practice. This is what I'm comfortable doing now. Maybe in a few years it might be different. But this is I don't want to do more than this. There's nothing wrong with that at all. Like to me, that's not a bad mindset. I just think in my clinical practice, I've always wanted to be anything and everything within the implant world. I want to be really good at it. And that's kind of how I run my practice.
I like that. And I think that if in your mind you're content with the procedures you're doing, that's great. But
100%.
but if but if you're looking at someone's Instagram account and you see their beautiful case, and a little bit of you is like, I wish I can do that, then that's when you have to realize, yeah, this is something you want to do. And, you know, be fearless, get that
Yeah,
continuing education, get the mentorship, and start trying
100%. And sometimes in dentistry, it means partnership. Like going back to like seeing cases on Instagram, right? So I do a little bit of process associated with my implant dentistry, but I'm not taking a full case full of veneers and just crowns and that kind of thing, right? Um, I think I probably could hack my way through it, but I don't want to, right? Like I don't feel right doing that to a patient. My passion doesn't lie in that, right? So I have no problem piggybacking a case like that with my prosto buddy, right? I'll say, hey, I saw this consult today. I took a tooth out. We grafted it. This is also a true story. Saw the consult today. I took a tooth out. I grafted it. She's a full mouth rehab. I'm sending her over to you. You can start your workup. When she's ready for the implant, I'll put the implant in. But this case is really all you. There isn't enough in that case for me to be committed and passionate about it. This is a full crown and veneer case for a prosthodontist or a general dentist that kind of likes that kind of work, right? So I think there's nothing wrong with tag teaming a case like that. And I do some of that with some other clinicians, right? I have a friend of mine who does a lot of veneers, and I would do some surgery for her. So she'll restore the implants. She'll just, hey, can I have you place this one implant? Or again, going back to my prosto buddy, he does surgery, right? And really, if I'm doing surgery for him, it's something he doesn't want to do, but for the most part, he does surgery. So there's nothing wrong with collaborating in dentistry. Where if you do some ortho, maybe you do some clear aligners and you come across a case that's going to be challenging. So work up that case with your orthodontist, right? So you're like, hey, I actually do a lot of these cases. I find this one to be a little bit challenging. Can you do this part? And then I'm going to take over and I'm going to restore. There's no orthodontist on earth that's going to say no. They're going to be like, yeah, absolutely. Let's figure out how to do this together. So I think when looking through these social media can be so deceiving. So like for the new grads, if you're getting into a new procedure, um, as somebody who posts on social media, and honestly, I try to post some complications. Um, for the most part, especially if it's Instagram, like we're posting, glory shots. We're posting, our
Yeah.
high shots. We're posting our praise and whatnot. But like I have a file in my pictures, like I have a thing, and it's just complications, right? And it's just all day complications. Like I can do a full weekend lecture of my complications, right? Like I'm not out there shaming somebody else. I'll show you my complications. Um, and I think it's very fair. Anybody who's in my kind of scope of work pretends like they don't have complications is just full of lies. 100%.
So, Mo, speaking of Instagram, you have this fantastic page at Toronto Implants,
Yes.
and you also provide mentorship. So tell us
Yeah.
about that. Tell
So
us about your
I
upcoming
my
courses.
my core, so again, going back to having three kids. So a lot of times I'm just really busy. So I'm not organizing like A to Z courses, like full implant residency, Timax style programs. But what I do is more of one-on-one mentorship. I love it for many reasons. Obviously, I'm really passionate about this. It is the way I learned. A lot of my education was one-on-one, where I spent time with a certain clinician learning something, and then another clinician, and then a lot of shadowing. I did a lot of shadowing. I'll still shadow anybody who lets me in their door. Um, but I believe that's probably the best form of education. If you go back, like as humans, right, like how we taught each other thousands of years ago, it wasn't classrooms with 200 people. It was, whether you're a plumber, a mechanic, a scientist, a psychologist, we did a lot of one-on-one where you go and spend time with a certain individual learning something and another individual learning something. And I think you don't go off and create your own school of martial arts unless you've mastered a whole bunch of other stuff, right? So I believe in that. And the one-on-one stuff that I do in my office, Unfortunately, it tends to be a little bit more advanced stuff, just because I don't know how to make it valuable for the money that you pay to just come in and learn how to place, how to do local anesthesia to place your first implant. But we do a lot of it as in partnerships with implant companies. So the implant company will sponsor a doc, they'll come in and they'll do the case with me. So we do some where it's lateral sinus lifts, a lot of full arch stuff. Um, Full arch has been kind of the biggest hit. A lot of people want to learn how to do that and how to integrate it in. So when they come in and do the case with me, we're doing the case, right? They're not shadowing, they're doing the case with me. So they'll come in, they'll do the case, they'll see how we do it restoratively. The lab side of it, we have an in-house lab. So how we use photogrammetry, how we make same-day temps, how we fabricate our temps. So I'll kind of go through the motions of the whole thing. And quite honestly, especially with those shadowing, I find a lot of times when someone comes to shadow and sees a case from A to Z, they're like, "Oh my God, there is so much more to this than what I saw on Instagram." Right? Like I am not ready to do this. There's a lot that I feel like I need to do first. And I go, yeah, yeah, for sure. Yeah, there's a lot of things that you're applying, right? A lot of concepts that you're applying. So if you've never laid a full arch flap, yes, there's a full arch flap involved. If you've never sutured somebody, from ear to ear, you're gonna have to learn how to do that. So there's many things that you're stacking to get there. But yeah, we do the in-office mentorship is one of my favorite things. If somebody wants to reach out. My Instagram, I try to keep it active. I try to post it once a day, usually at least a few times a week. And a lot of times it's just kind of like what's going on today, right? So we're restoring a case, it's a complication, something that broke. I do try to post some complications on there. I had a couple weeks ago broken screw that I was removing a screw and an abutment. It's part of life, things will break. I've had some of my own, I think, but a lot of them tend to be somebody else's. And it's not because somebody else did something wrong, honestly. It's unfortunate. Screws break, things break, people break everything. Um, so that's the Instagram and education. The some of the other stuff that I do is we'll do like we have this will have aired, but I've done trips to Mexico where we take a small group and we go out to Mexico and we do some hands-on courses. So we have one coming up in April, but it's gonna be after this episode airs. But we're gonna do it again in the fall, right? So my goal, if you're going to go abroad and do one of these courses where you're putting in implants, I don't think the goal should be how many screws can I squeeze in the 4 days or 5 days on this trip. The goal should be what do I need to get out of this so I can go back and do this by myself comfortably. It has to be, it's still like it has to be ethical. We're still dealing with human beings. This is still somebody's mother or daughter or sister. So when we go over to Mexico and we do this, the goal is always, the standard of care is our standard of care. We're still taking CT scans on all these patients. Somebody's restoring them. It's a great facility that we work out of. But my goal when I take a doc out there is when you come back, I want you to be able to place a implant on your own. And that generally is the case, right? Like you've never placed an implant, you've never done this. You're going to go home, you're going to be comfortable to do this on your own. So when somebody comes in for in-house mentorship, I tell them that. I go, listen, the goal from this is that you should be able to take things from here that you're going back to your office tomorrow and you're doing on your own.
Oh, that's great. And for the course that you do in Mexico, what's it called?
So we run it out of a Megagen facility. So most of my education stuff and partnership is actually with Strawman, but I do this one with Megagen. I do work with Megagen as well, and they have a beautiful facility in Tijuana that they recently built. It's like 3-story. It's a beautiful facility out there. I think they have 3 different CT scanners, intraoral scanners, piezo's, multiple motors, multiple different. You get to play with Versa drills and stuff. And then when we do it, we usually split the group into different levels. So we do beginner, intermediate, and advanced. And then the beginner group, they're placing their very first implant. The intermediate are learning some more advanced techniques. And then an advanced part is I want to learn how to do lateral sinus lifts. I've done it once. I've perfed. That, true story. I've done this once and I've perfed and I never did it again, but I really want to learn how to do it. Great. So, we'll do some sinus lifts there. I want to do some full arches or immediate implant placement. So I do tons of immediate implant placement. I love immediate implant placement. I don't think your very first implant should be an immediate implant. Same with immediate load protocols. So I think, again, layering different things takes time. And at that facility, it's great because the volume is there, the patient's in there, everybody knows it's a teaching case. So it's a great environment to learn. And then there's plenty of docs around to help out somebody to look over your shoulder, grab the handpiece, and put things in.
Oh, that sounds fantastic.
Yeah.
And well, you should also tell the audience about your new club, the
So
new
that is what
dentist.
I'm really excited
Yeah.
about. Yes. So the partnership between me, so I've had this not so secret admiration with you and the new dentist study club. Honestly, I love it. I love what you guys stand for. I love being part of it. I love being associated with it. I love the culture behind it. I love the vibes behind it. And I think you and I got along where we tried to pitch this and it's come into fruition into life, but it's essentially
Yeah.
we're launching a like a shoot of the New Dentist Study Club, where it's just New Dentist Study Club, but it's an implant club. So it's
Yes.
New Dentist Implant Study Club, and it's just gonna be this. It's the same culture, it's the same vision. We're focused on camaraderie and growth and building each other up. I I look at dentistry as from a place of abundance. Like I don't look at my those around me as like we're all competing for the same teeth and the same implant sites. There's plenty of cases out there. Toronto's like, I don't know, 6 million people on its way to be 20 million in a few weeks, probably. Uh, there's plenty of patients out there, right? So I'm very excited about it. It's something I've wanted to do for a long time, and I have to give you credit for pushing me to do it. I was really nervous about doing it, but I'm really excited about bringing this to life. I'm hoping by the time this airs, we'll have the announcement on Instagram, and we'll have the
Yeah.
enrollment have opened. Again, we're trying to keep it small and to see how it'll go and then grow from there. But the goal of the study club is it's an implant study club. Focus on new dentists. I don't have a definition for new dentists. If you've been doing this for 20 years and you still consider yourself a new dentist, hey, my arms are wide open. Come on in. This is a place for you.
I
Um,
feel the same.
yeah, 100%, right? Like I'm learning every day. Like I don't know what new dentist is. So it's just, you know, it's learning, it's growing, and it's not just me lecturing. We have some speakers lined up, so it's different perspective, people talking about different things, and we're gonna have a few hands-on sessions. So we're planning on having a hands-on suture session, which is always really, really fun. It's one of my favorite things to do is a hands-on suture like clinic kind of thing. And then we're planning on multiple events with one social event at the end of the year to kind of celebrate the year coming to an end. So I'm very, very excited about it. Look for an announcement on Instagram for it, and we'll have a link for signing up on there as well.
Yeah, the new dentist implant study club will launch September 2025 in
For sure.
Toronto with Dr. Moemen Metwally as the lead.
Yeah.
And Mo, how can the audience get a hold of you?
The best way is probably Instagram. You can reach me by email. I think I have my email on my Instagram as well, but best way is probably Instagram. That's generally how most people will get a hold of me. So my Instagram handle is toronto.implants. And yeah, I'm pretty active on there. If you message me, if I don't get back to you like right the second, I will, within the day probably. But that's probably the best way. My practice is Van Horn Dental. We're going through a rename, so it's going to be Revived Dental Implants really soon. But Instagram is probably the easiest way to get a hold of me. If you have a case or if you have something that you want to something off this that you had a question about, feel free to reach out there. But I get people that will contact me through Instagram probably more than anything else. I think in my whole career, I've had somebody email me once. So Instagram is probably the easiest way to get a hold of me.
Yeah, and I think by the end of the year, Mo and I should run a marathon. A fearless guy like Mo, yeah, yeah,
Yeah,
we're gonna run a
no.
marathon at the end of the
Remember the
year.
pyramid? I don't have a base for that.
We need to get a lot of layers between
Yeah,
now and
there's no
December.
layers there. There's no training. I'm gonna die.
Thank
But it
you so
has
much,
been, in
Mo.
all fairness, it's been on my like at some point in my life, I would love to check that off and say I've run a marathon.
Okay, I'm gonna do it with you.
Yeah, that would be amazing.
Okay, let's do it together. Okay, thank you so much,
You're
Mo, and
very
thank you,
welcome.
audience, for listening. Please
Thank
tune
you for
into the
having me.
next
This was
episode.
fun.
Yeah, it was fun.
Yeah.
Grateful for you, Mo. Grateful to the audience. Bye.
Bye. Have a good day.
This podcast is sponsored by RDT Dental Laboratory, your full service dental lab in Toronto. RDT Dental Lab will help you grow your practice through education, predictable restorations, and high attention to your clinical needs and patient experience. Check them out at rdtdentallab.com. Thank you for listening to the New Dentist Study Club podcast. Listen to us on Spotify, watch us on YouTube, share and subscribe, and follow us on Instagram at New Dentist Study Club.